Okay, you're live.
Hello and good afternoon from Bethlehem. Welcome to Lehigh's 4th Annual Giving Day. I'm Joe Buck, the Vice President for Development and Alumni Relations here at Lehigh, and me and the team help Lehigh's vision become a reality through alumni support and engagement. But today, my role is specifically to talk to you about Giving Day. So what is Giving Day? Well, as you would imagine, it's a day, 24-hour event where we invite you all, alumni, parents, faculty, staff, friends, to support any area of Lehigh that you care about. Our goal today, 1,865 donors to acknowledge that Lehigh was founded in 1865. Giving Day is all about the community coming together to make a difference to Lehigh. Every gift counts. No gift's too small, no gift is certainly too big. They all count. You'll see a lot of areas today that don't generally raise money to support themselves. Today's a chance for you to find your area of interest at Lehigh and make a difference. This is our 4th year. Each year, we've tweaked things a bit, trying to experiment here and there. So this year, we've put a lot more emphasis on peer-to-peer fundraising. We have many more challenges and matches from generous alumni, and we're producing this live introduction as well as a live broadcast at 7 o'clock Eastern time when my colleague and I, Jennifer Cunningham, will give updates on how the day's going, what challenges have been met, and show you some great content from all around the university. So why give today? Well, let me tell you, there is over $100,000 in matching money available from our generous donors. We've lined up so many matches, I would almost guarantee that you will find some area of interest where your money could be doubled. But matching gifts, many of our matching gifts will go directly to financial aid via the Lehigh Fund to help current students. So here's an example of some of the matches that we have going. When we get a gift from all 50 states, now generally we're pulling hard for South Dakota and Nevada. When we get all 50, and we have in the past, we'll unlock $5,000 for the Lehigh Fund. As of right now, we are at 32 states, 32 states. Dean Georgette Phillips is going to match all gifts to the College of Business up to $1,500. And there's some that we've already achieved. Dining Services is giving out cookies and brownies and coffee to the students because of the generosity of our parents. Thank you, moms and dads. We have unlocked the bookstore challenge. We have unlocked the faculty and staff challenge. We've unlocked the Southside Business Challenge. We have added $2,500 to the Lehigh Fund because our students are right now writing hundreds of thank you notes outside of Fairchild Martindale Library. We are about halfway to meeting all of our matches, which you'll see on our website, LehighGivingDay.com. We have challenges for specific classes. So if your class gets the highest percentage of donors, you'll get $1,000 towards your next reunion. Anyone from the class of 1950 to 1977, the chair of our Senior Alumni Council, Mark Shiner, is going to match those gifts dollar for dollar up to $1,000. Before I go any further, I have real live info just sent to me about where we are for today. As of a few moments ago, for Lehigh Giving Day totals, 629 donors, $181,000 raised today. That does not include the $100,000 in match money that we just spoke about. So closing in on almost $300,000 in commitments for today. As I said, 32 states represented. Let's hope we can get a couple more during this mountain talk as the West Coast wakes up from their overnight slumber, and we'll get the West Coast engaged here very quickly. And right now, of all the priorities, the Lehigh Fund is in the lead, 132 donors and $63,000 raised. And they unlocked a special challenge from an anonymous alum we unlocked an additional $17,500 for the Lehigh Fund. So in addition to the generous donors who provided the matching funds, we also have around 25 people who we're calling Giving Day fundraising ambassadors. These are your classmates, your teammates, your friends who signed up to ask their networks to support the causes they believe in. So, for example, the Ultimate Frisbee team, currently in second, I'll talk more about that in a moment, is raising money to support their effort. And they currently have 16 donors and about $1,300 raised. If you feel strongly about your area, it's not too late for you to sign up to be a fundraising ambassador. As I mentioned earlier, it's a way for you to engage people in your network to support something that you care about. If you go to the fundraising tab on the Lehigh Giving Day website, you can find out how to sign up there. And we are going to offer little prizes to the top 5 fundraisers. As I mentioned, Ultimate Frisbee team is raising money. They're currently in second to the Graduate Student Life Office.
Joe, this just in, I literally just refreshed the page, and Gary Chan, the president of the Lehigh University Alumni Association, just overtook the Ultimate Frisbee team for second place.
Well, Ultimate Frisbee, you're on notice. Gary Chan is a force to be reckoned with. I know Gary personally, and he has a big network. So Ultimate Frisbee, let's get after it. And that's also a call out to Dave Beard, who is a friend and colleague of Gary's, and perhaps, Jennifer, we can get a little head-to-head competition going. Yeah. Gary's a former Lua board member, Wall Street Council member. Dave was in third, now in fourth. Dave had $1,300 and about 8 donors. So Gary Chan has surged into second. Brad, Student Life Office, still in first. $3,000 and about 20 donors.
Yep.
21 donors. Oh, they added one since I got the update. This is real-time updating here. So that's a little bit about what Giving Day is all about. I hope that you find a way to make a gift or 2 or 3 or 4 and spread the word and ask people to become an equity stakeholder in Lehigh's brand. It will change your relationship with the institution if you have not done so. And if you have, thank you. And I hope that you use a Giving Day as a way to participate in this great institution. I'll remind you again, LehighGivingDay.com, 7 o'clock tonight. Please tune in. Jennifer and I will be doing our best election day coverage, Giving Day coverage, to give you an update and share some highlights from around campus, and also introduce our version of Family Feud called Lehigh Feud. We're pitting young alums and against current students to see who knows the Lehigh community the best. For example, you will find out tonight, what is the favorite sandwich at the Goose? Last thing I'll say about Giving Day, as I said a few moments ago, is that every gift counts. Every gift counts. And every gift counts as part of GO, the campaign for Lehigh. We at the institution organized this campaign intentionally to be comprehensive. And by the nature of being comprehensive, every gift counts. This is not a campaign that is only highlighting the areas of need for the institution. It is also highlighting the areas of opportunity for our donors to engage in and make investments in. And that is what makes it comprehensive. And that's how I can confidently say that every gift will count, and every gift will count in part as participating in GO, the campaign for Lehigh. So thank you. We are about to get ready for the Mountain Talk with Dr. Fathima Wakeel from the College of Health. I hope you'll stay tuned for the next 30 minutes. The topic could not be more timely as she explores and engages in your questions around using population health to inform pandemic policy. Jennifer, I'm going to turn it over to you. This is Jennifer Cunningham, our AVP of Alumni Relations in our office, and she is the host of our Mountain Talks. Thank you for letting me give you an update on Giving Day, Go Lehigh, and Jennifer and Fatima, thank you.
Thank you, Joe. All right. Here we are for our regularly scheduled Mountain Talk, and wanted to point out that today's Mountain Talk is also part of our Soaring Together 50 Years of Coeducation at Lehigh celebration. It was 50 years ago this year that Lehigh allowed women to come to Lehigh. And just a note on that, with Giving Day, we have established a part of the scholarship that goes to women, the Lehigh Scholarship for Women, and we have a $50,000 challenge from Board of Trustee member Maria Schrin, who, if 500 women give today, then she will give an additional $50,000 for that scholarship. So just wanted to mention that as it's sort of part of the whole Soaring Together celebration. So now, right into the webinar. Hello, Dr. Wakeel. As Joe mentioned, I'm Jennifer Cunningham, AVP of Alumni Relations. And the way these Mountain Talk works, if you haven't been on them before, is we will hear from Dr. Wakeel for about 10, 15 minutes, and then we will open it up for your questions. To ask your questions, put them in the chat box, and I will read them aloud, and so that Dr. Wakeel can focus on her answers to you. We are recording this. I have to say that for legal reasons, but I hope that you enjoy this as much as I know I will. All right, Dr. Wakeel, take it away. All right, Dr. Wakeel, you're muted. There you go.
Sorry, I was having some technical difficulties there. I apologize. All right, hi everyone. Thank you so much for joining me today during Lehigh University's Giving Day. Today, I'd like to share with you some of the research we've been conducting at Lehigh University to learn more about the impacts of the COVID-19 pandemic in the Lehigh Valley and in the nation in order to inform programs and policies aimed at improving the health of the population. So first, I would like to briefly tell you a little bit about myself. I am an associate professor and the director of graduate programs at the College of Health. I received my PhD in public health at UCLA and my Master of Public Health at the University of South Florida. I also completed my postdoctoral training at the University of Wisconsin-Madison in maternal and child health disparities research. My primary research interests lie in maternal and child health, specifically the conceptualization and measurement of maternal resilience among women in various racial, ethnic, and socioeconomic groups, as well as the development of resilience across the life course. So in my career, I have truly enjoyed and have been committed to community-based work. I have closely collaborated with community organizations on health issues such as opioid misuse prevention, the promotion of tobacco-free policies, and since I joined Lehigh in January 2020, the investigation of the physical and mental health impacts of the COVID-19 pandemic in the Lehigh Valley. So in this presentation, I will be telling you a little bit about the COVID-19 study that I initiated shortly after the lockdown occurred in March 2020. The overall goal of this multi-phase study is to examine the physical and mental health impacts of the COVID-19 pandemic in the Lehigh Valley, as well as in the nation. So there are 3 phases to the study. So we already knew from emerging data at that time that the pandemic was disproportionately impacting vulnerable populations, such as racial ethnic minorities, low-income individuals, the elderly, and individuals with underlying health conditions. So therefore, in phase 1, I wanted to obtain a 30-foot view of the immediate impacts of the pandemic in the Lehigh Valley community, as well as the impacts on the infrastructure of community organizations and human service providers in the Valley. So I conducted 13 informant interviews with a wide range of community stakeholder leadership from April to June 2020. This formative research helped inform the development of the survey we used in the phase 2, which is the community study. So we are currently collecting data for the community study, and we're also in the process of developing the survey instruments for phase 3, which is our nationwide study. So as I mentioned earlier in phase 1, I collected preliminary data regarding the community's strengths and needs amid the pandemic by conducting 13 informant interviews with individuals who serve in leadership positions within human service and healthcare organizations. While I don't have all the time today to share my findings, community leaders consistently cited 3 community priorities that have been further exacerbated during the pandemic and lockdown. These include homelessness, food insecurity, and mental health concerns. So many homeless shelters and warming stations had temporarily closed or turned away newcomers, therefore exposing many homeless individuals to cold weather and heightened health risks during the lockdown. Further, we know that 1 in 10 Lehigh Valley residents are in fact food insecure. So with the closing of schools and decreased frequency of meal distribution pickup and deliveries, food insecurity had become a larger priority during the lockdown. However, community leaders stated that they had quickly pivoted to address this issue. For example, delivering more meals during each drop-off, and also, as well as drive-through meal distribution sites for low-income families. And then finally, community leaders voiced their concerns about the deleterious impacts of increased social isolation and emotional stress during the lockdown on individuals with existing or newly emerging mental health issues, which are further compounded by the reduced opportunity for mental health providers to screen for and address mental health issues during the lockdown. So as I was collecting data for phase 1 of our study, I also worked on assembling a multidisciplinary research teams comprising faculty from every college at Lehigh. This was intentionally done because population health is a convergent science. So I wanted to bring together experts from the university who would be able to contribute their unique disciplinary perspectives on a topic that impacts us all, as well as their rich diversity of substantive and methodological expertise. I am indeed very grateful to have formed 2 study teams, one for the community study and one for the nationwide study, comprising 1 to 3 faculty from every single college at Lehigh. Our study teams have also been very fortunate to have recruited 3 undergraduate and 2 graduate students from various colleges at Lehigh as well. So the community study team began meeting in May 2020. We decided to conduct a mixed method study comprising a quantitative component, which was an online survey, and a qualitative component, which was follow-up semi-structured interviews. For the online survey, we aim to recruit 500 Lehigh Valley residents each of whom would receive a $5 gift card incentive for participation. And then participants who completed their survey would then ask if they were interested in doing a follow-up interview. So we aim to recruit 45 to 60 participants for the follow-up interview, each of whom would receive a $30 incentive for their participation. We also wanted to invite essential service providers for the interview component so that we could learn more about their unique stressors and experiences during the pandemic, as well as more about the needs of their clientele, many of whom we had difficulty reaching out to directly, such as the homeless population. So in summer 2020, we worked to develop our survey instrument and the interview protocol, obtain IRB approval, and we also applied for and received an internal grant from the Lehigh University's Office of Sponsored Research to carry out the study. So an important feature of our community study is that we really aim to intentionally recruit individuals from vulnerable populations within the community, such as racial ethnic minorities, the elderly, those with chronic physical or mental health conditions, those who have children with special healthcare needs, low-income individuals, and women who had recently given birth or experienced pregnancy during the pandemic. Therefore, we reached out to, and we continue to reach out to, a wide range of community partners to advertise our study and reach their clientele. So as you can imagine, recruitment for the community study has been extremely challenging as community organizations are already overwhelmed with COVID-related demands and stressors and changes. Additionally, of course, community residents themselves are experiencing unprecedented stressors and difficulties during this time. Therefore, it has taken much longer than expected to collect the data within the community, but a silver lining to all of this for this process is that we've had the opportunity to collaborate with a long list of community organizations. So on this slide, I just wanted to give a shout out to the amazing community organizations who have been working with us to disseminate the study, despite all of the additional stressors they have been facing. I also wanted to quickly share the main topics that we included in our online survey for the community study. So some of them are listed here. Health status, we looked at changes in lifestyle behaviors during COVID, risk perceptions and behavioral responses, specifically regarding preventive measures, stress, coping and finding new meaning during the pandemic, social relationship factors, sources of health information, employment and changes in employment, access to care and community resources during the pandemic, household characteristics, including food insecurity, and families who had children with special healthcare needs, as well as demographic characteristics. So once we complete the community study, we anticipate some key short-term and long-term outcomes from this research. The results of this study will provide novel insights into the short-term impacts of COVID-19 on the Lehigh Valley community. We aim to disseminate our data in 3 ways. First, findings from our community study will be presented to community organizations, that is the whole point of the study, in order to inform programmatic and policy interventions and also connect community stakeholders across the 2 Lehigh Valley counties with the aim of developing a more coordinated response to the pandemic. More broadly, our results will highlight the need to consider both short-term and long-term impacts of health threats, such as infectious disease outbreaks, on the community when developing preparation policies for future such health threats. Second, we aim to collaborate with community organizations to communicate findings through data storytelling, which will deeply impact the Lehigh Valley community by raising awareness about the leading health needs of community residents, and also highlighting experiences of personal growth and resilience. Third, the research teams will be able to collaborate and develop multi-authored peer-reviewed publications using interdisciplinary conceptual and methodological approaches. Further, this work will provide a foundation for future community-based research endeavors, such as a potential follow-up study on the long-term impacts of the pandemic on community residents and organizations, as well as long-term academic community partnerships that reach beyond the pandemic and further strengthen the relationship between Lehigh University and the surrounding community. The project will also lay the groundwork for future cross-college collaborations, examining health issues of mutual interest, as well as peer mentoring among team members and students who are in various stages of their careers. Finally, the study provides an opportunity for the research teams to establish their ability to conduct this research and therefore make us more competitive when we're applying for external funding to support future expansions of the study, as well as other interdisciplinary research. So finally, today, I'd like to touch briefly on the nationwide study. So the nationwide study team has been meeting since January, and we have been in the process of creating 2 online nationwide surveys. One will be aimed at parents who have children under age 18, and one will be aimed at the general US population. We aim to explore some of the same constructs that we did in the community study, such as health status, access to healthcare and community resources, social relationship factors, stress, coping, and post-traumatic growth. Some additional areas of interest will include children's academic and social outcomes during COVID, vaccination intentions and behaviors, medical mistrust, and finally, the use of telehealth. So thank you so much for joining me today. I'm now happy to answer any questions that you have.
Thank you so much. We actually have a question here from Eric. He says, Dr. Wakeel, excellent work. IRB approval was mentioned. What organization provided such oversight and how was this organization engaged?
Well, wonderful question. So we were able to receive IRB approval right here at Lehigh University. So we applied here and we received it fairly quickly, actually. And we have been doing amendments all along the way as we've made changes to our protocol.
Nice. So everyone else, the way again to ask questions is to just put them in the chat box, and you can make them available just to the panelists or to all panelists and attendees. While people are thinking of their questions, I was wondering about if you could talk a little bit more about vaccines and how are you going to be studying the effect of getting the vaccine, not getting the vaccine, educate all of that on this population?
Absolutely. So we didn't get a chance to study vaccines in our community study because that wasn't that vaccinations were not available when we created it. However, that is a chief point of interest in the nationwide study. So we're asking a lot of questions about vaccination intention, as well as behavior, as well as past vaccination behavior, because that doesn't, that definitely does inform future vaccination behavior. especially when it comes to vaccinating children. So as we know, we're working, they've been working on creating vaccinations for children and doing those trials right now. And they're hoping, in the fall or even in the winter, we might have children as young as age 2 vaccinated. So the nationwide study is really trying to understand whether parents, so that's really for the parent, the parent survey is really trying to understand, would parents be interested in getting their child vaccinated? Why or why not?
Right. Okay. Katrina has a question. Can you describe the preliminary results?
So right now with the community study, we don't have any results just because we haven't had, we have data, but we haven't been able to analyze them yet just because it wouldn't be statistically sound because we don't have enough respondents yet to do that. So the results that I shared with you from the informant interviews though were really interesting. So community stakeholder organizations have really went through quite a big change during the pandemic. For example, many of them had to, furlough their employees. They were really worried about their budget for the 2020-21 year, and then understanding what that was going to look like that fiscal year. But one key takeaway that I got from those interviews, but they were just really exceptional in terms of being able to pivot to the pandemic and really meet the needs of their clientele, really going above and beyond to meet the Lehigh Valley, to meet the needs of the residents of Lehigh Valley. So there was lots of stories of resilience, which I was able to capture there.
Nice. So speaking of the Lehigh Valley, Catherine's question is, what differences do you expect between regional and national study findings?
That's an excellent question. And that's really one of the key goals of the nationwide study is to see, what are the differences between, what's happening here in Lehigh Valley and in the nation. One thing that I've learned in my short time here in Lehigh Valley is that Lehigh Valley is extremely diverse. And it's been told to me by multiple people that it in fact reflects much of the US in terms of demographics and in terms of health issues. So I also, I predict that what we see in the Lehigh Valley might very much predict what's happening in the, in the broader scale in the US, but we'll see, we'll find out.
Right, which also sort of folds into Frederick's question. Do you identify the demographic differences, including political party and ethnicity?
That's a wonderful question. So we did not ask about political party in the community study. We did ask about race and ethnicity because we were certainly, as I mentioned, looking to recruit people from vulnerable groups such as racial ethnic minorities. However, in the nationwide study, especially in the general survey, we are planning to ask about political affiliation because we do hypothesize that might impact many different types of information, such as maybe even like vaccination behaviors and intentions, medical mistrust, et cetera.
Right, there are several studies out there that show that. Yeah. We have a question from Facebook Live from Jerry. Had you or might you also consider drug and alcohol addiction? He says drug overdose deaths increased 29% nationwide in 2020.
That's a wonderful question. We do ask about changes in substance use and in tobacco use during the pandemic, in the community study. Because the nationwide study, the surveys were getting so long, we weren't able to include everything. And we wanted to shift the focus to more of the vaccinations and medical mistrust and some of the other issues. We didn't end up asking about that, but we did include that in the community study. So we are definitely interested to see if there is a spike in changes there in an uptick, of course, and from some of the data that I've seen there, I can't say this is statistically sound. There has been an uptick in some of the data we've seen.
Yeah.
Absolutely.
Yeah. So once you crunch all the data and you've had some time to reflect on that, how are you going to release that? Do you go into medical journals? Do you release a press statement? Like how would people on this call see the results of all of this good work?
That's a wonderful question. So as I mentioned, we do plan to work we have our research teams and we're going to be publishing this, in research journals. But more importantly than that, especially for the community study, we really want this information going back to the community because it's really for them that we are doing this work. So we want to be working with community organizations directly. to find ways to disseminate this information. So if it, for example, helps them in fundraising, if people know what the needs are for, in the community, we, plan to work on data storytelling and data visualization to show these results in a really compelling way that reaches people, in the community to know what's going on, and not just really highlight what, the stressors, but also highlight stories of resilience and growth. Not, to really take a strength-based approach, because we know that, families have certainly been resilient and organizations have been resilient here and throughout the country.
Yeah. Kathy has a question. Has COVID changed how you think about or approach your individual research study of this collaborative COVID study?
Absolutely. So as I mentioned, it's been extremely, ironically, we've been trying to explore COVID, but because of COVID, it's been hard to recruit, participants. So organizations are really busy. Obviously individuals, this is not a high priority item to fill out a survey. Individuals have lost their work. They're, looking for work. They've lost housing. They've had some really important, stressful life events that have occurred during COVID. That are going to definitely inhibit them from, filling out our survey. So those are, interestingly, those are exactly the individuals we want to reach and learn more from. So we've been working really hard to, work with community organizations and to reach those individuals.
Right. A question about that, about the reaching people. Somebody asks, how do you reach those without phone or internet capability?
Yes, that's a great question. So one of the organizations we've been working with works specifically with homeless individuals who come to their site for food and for resources. So one of the things that they've done, they've agreed to do, is set up computers right there on their site that are set up with the survey, so that the individuals could take the survey right on their site. So we're working with people that way. And then some of the things that we're going to start doing also is having some of our student volunteers out there who are vaccinated, on site, providing, the survey, at least the code for the survey, if people have a phone, for example, that type of thing, or maybe, vaccination sites, for example.
Yeah, that's tough. Susan's question, have you been collaborating with other researchers who are doing similar studies in other parts of the country?
That's a great question. We have not so far. Our research team is fairly large as it is. Within Lehigh University, as I mentioned, we have 1 to 3 faculty from every college, and we have students. So we haven't done that quite yet, but I imagine that once we get started on that nationwide study, that might be something of interest. And we've been doing a lot of, we've been looking at the literature very closely to see what's out there so far and try to build upon that and contribute to the literature. But we haven't had a chance yet to collaborate with other researchers across the country.
Yeah, I predict that once you come out with this, there will be a lot of people calling you, wanting to collaborate.
Absolutely.
Margaret's question, some people believe the impacts of the pandemic will last many years. Can your study be extended to look at those long-term impacts and when or whether or how they end?
That's an excellent point, and I too have the same prediction. So one thing that I had mentioned is ideally we would love to do a follow-up study to really look at the long-term impacts of this, maybe a year from now, 2 years from now, to really see, what is happening and how kind of people's trajectories have changed during the pandemic, and what the evolving needs are as we continue to try to get out of this pandemic.
Yeah. Of all of the research that you've been doing, what is the thing that has surprised you the most?
In terms of this study, or?
Yeah, well, I guess this study or anything that you've been studying, you cover a wide variety.
That's a really great question. I think because I come from a place that, I am really interested in resilience. I think the thing that shouldn't surprise me, but does surprise me, is that people are very resilient. Something like the pandemic that affects us in so many ways, people have lost loved ones, they've gotten very sick, they've lost employment. I feel like, from what I've seen and what I've seen in the data so far, is that people are still carrying on and being strong, and it's and that's wonderfully surprising.
Good. we are almost at the end of our time here. I just wondered, what would you like to tell us that people haven't asked yet? Is there anything else that you had to leave out? Because I know we only gave you a short window.
I think I covered the main points of my study fairly well. It's we're moving along. It's taking longer than expected, but that's the wonderful part of working together in a team. It does take a long time, but you're able to get everybody's voices heard. And working in the real world and collecting data takes longer than anyone expects, especially during a pandemic.
Right.
But the payoff will be big, which is what I'm excited about, is getting this data and being able to share it with the people who need it.
Right. And you say it's taking a long time. You've only been here a little over a year. So
Right.
as you were talking, I had to look up because I thought, man, I swear she just started. It seems like you've done so much in just a year and a half or less than that.
Right.
So that's great. Someone is asking, what's the building behind you?
Oh, this is the our HST building that's in the process of being constructed. So this is where the College of Health will be housed, hopefully later this fall.
Yes, we're planning on a groundbreaking. We'll send out the details to everyone on this call. I believe it's May 20th. There will be some kind of a groundbreaking, I think. I'll have to check my data on that. But well, thank you so much, Dr. Wakeel. This was fantastic, and congratulations on all the good work you've done. Again, I know you think it's going slowly, but it sounds like you've covered a lot of ground in the last few months. So
thank you.
Thank you very much.
For having me.
Yeah, so thank you everybody on the call. I did want to just update, I was refreshing my Giving Day page. We're already in the time that we've been on here. We've had about, let me do the math quickly, about 40 more donors. We're past the $200,000 mark. So if you haven't given yet, I invite you to do that, LehighGivingDay.com, and you can give to the College of Health and to HST. And remember that all gifts from women will help unlock a $50,000 scholarship. And there's plenty of other matches that are working for us here today. So thank you again, Dr. Wakeel, and I hope to meet you in person very soon.
Thank you.